This meeting is being recorded by the city of Greenfield. If any other persons present are doing the same, you must notify me at this time. Okay. I as the chairperson, reserve the right to remove or have removed any person or persons because of profanity, threats, or any continued disruption during a meeting. Okay, so roll call. Nancy Bershoff, I'm the chair of the Board of Health in Greenfield.
Jennifer Hoffman, Health Director for the City of Greenfield.
Megan Tudrin, Public Health Nurse.
Nicole Grayback, Health Inspector.
Thank you. Great, okay. We cannot approve the minutes because we don't have Alyssa here, so we'll defer that item. But I would like to welcome our newest board member, Samantha McIver. And Samantha, I'm going to ask you if you would just give a little introduction of who you are and why you wanted to join the Board of Health.
Hi, I go by Sam. Most people, that's what they call me. I was born and raised in Greenfield. My dad worked for the DPW for 40 years. My husband's a firefighter. I've been part of the rec department. I've worked on the youth commission. I had a home daycare up until COVID for 8 years. This is my daycare space here behind me still. Yeah, I've been involved in a lot of different town stuff and haven't done anything recently. So I was asked if I had an interest in it, and here I am.
That's great. Welcome. And I know you haven't been sworn in yet officially, so you can't be a voting member just yet, but you can take in all the information and certainly ask questions. So thank you for joining us. Jennifer and Megan, I'm going to ask you to go ahead and give the COVID update if you would.
Megan.
Okay, I'm just going to share my screen because I think it might help to have a visual of what is going on. So I know the news makes it sound like the COVID numbers are going up, but that is not what we are seeing in Greenfield. So can you see my screen?
Yeah.
Okay. So this is the total number of COVID cases. So far throughout the whole pandemic, we've had 2,976 confirmed cases. So you can see the blue is 2020. The red is 2021. And yellow is this month, pretty much, not even, it's 24 days. And we are already way above what we've had for the past 2 years. Let me just pull up one more chart that I have. Here's the other one. This is just another way to show you what we are at for numbers. So we have the 2020 in blue, 2021. It goes by months, and then January 2021 to now we've gone from about 125 cases to almost 1,250. And this isn't just the beginning of the month. Like last Friday, I had 100 cases come in one day. You know, we were kind of stressed out when we used to get 20 cases in a day, and now it's up to 100. We've gotten to the point where sometimes we can't call all of our patients. We like to call everybody, talk to them, see how they're doing. But we haven't been able to do that on these really busy days. And we send text messages saying, if you have any questions or concerns, call us. Here's a website with some information. So it's not the ideal, but that's kind of where we are in this surge mode. Any other questions that I can help with on the numbers?
Like, I read that when I looked over the notes today and went, you're kidding. A third of the cases are this month.
Yeah, and that really only goes till the 24th because we don't have any cases from.
Yeah.
Yeah.
The good news is that we are having a VAX Bus. There's a whole bunch that are going to be out throughout the city of Greenfield, but one's going to be at the senior center for not just students, but for everyone in Greenfield on the 16th of February. And that'll be from 2 to 6 p.m. so we can try to just really emphasize to people about vaccines and boosters.
And Nancy, one other thing I wanted to mention is that
Yes.
these numbers don't include any of the at-home tests that people are taking.
Yeah.
So these numbers are probably about 2 to 3 times as high. Most of the time when I talk to families, one person got a test that was confirmed, so the others took at-home tests, and those are not documented anywhere.
Yeah. So in other words,
Usually
it's
we
much
find out
higher.
incidentally.
Yeah.
Like someone either says, yes, my spouse took a home test and they're positive, or my kids have a home test and they're positive, but that does not get reported to the state. So we are trying to keep track of that as best we could for more accurate numbers. But, you know, statewide, that's not reportable. So everyone that's getting these home tests, if they don't let the health department know, we don't know.
I haven't been following or receiving information about hospitalizations and ER visits. Where are we with those statistics?
I think it was 10 cases this morning. Our hospitalizations are way up. I don't believe we have anyone in ICU today that has COVID, but our hospitalization numbers are definitely higher.
You're talking about Greenfield?
Yes.
Yeah.
Yep.
And Bay State, how's Bay State doing?
We don't talk about,
You don't-
like, we don't
You don't have a
give
sense.
their numbers.
Yeah.
Bay State has decreased compared to how it was in the beginning of the month,
Yeah.
but they are still significantly high.
Okay.
You know, hospitals are desperate for help and they're looking for people to work a lot more hours to cover shifts. But basically, throughout the pandemic, Bay State Franklin had approximately maybe no more than 5 cases, and that was busy in the hospital for COVID. And now we're seeing on average 10 to 15, I would say, a day. Is that true, Megan?
Yeah, I wouldn't say 10 to 15 new cases, but hospitalized each day.
That's what I meant, yes.
Yeah.
Okay. Any questions from our Alyssa's about to sign in. I just got a message from her, but anything else from you two or let's see, yeah.
Hey Sandy, just wondering if you are going to log on to the Board of Health meeting. I've logged on and I have a question for you. So if you do log on, can you give me a call? Okay, thanks. Bye.
Okay. Um,
Susan Valley, I
Okay.
think you might be unmuted.
I don't know who that was even. Technology sometimes is beyond what I can understand. All right, let's move on. Okay. So, I would like to move on to a conversation about the LUT property. And Jennifer, will you give a little introduction of the situation?
Thanks, Nancy. So the LUT property basically was brought to our attention under me being the director and Nancy being the chair this July, past July. Prior to that, it was not known to our health department at the time, like under our leadership, what was happening with the LUT property. So when it was brought to my attention, I was speaking with Eric Twarg to find out some information, and I read documents. But this goes all the way back to 2005 when I was doing research. And basically, the health department itself, it basically just collects the information from the DEP and from the EPA and from the people that are doing the remediation. And basically, we really weren't, as the health department, based on what I've seen, greatly involved, except as gathering or collecting the information from these these sites. So what I do know is that the DEP was involved, and OTO, who was the remediation company, did basically what the DEP suggested and recommended. But currently, there is a petition, a public petition, investigating the LUT property because it's up for sale, and there is question about TCE contaminants in the area that could be affecting neighbors in the community. And I'll leave that to you now, Nancy.
Okay, well, you'll probably have to help me with some of the specifics. So I just want the board to know that I have gone over all of the papers that we've received from copies of from the planning board, the economic development folks in Greenfield, O'Reilly, Talbot, and Oaken. That's the company responsible for doing the cleanup. They have what's called the licensed site professional services, the Mass DEP, their documents, and I've spent quite a bit of time looking at them and to see what was done. And my understanding is that there was a lot of remediation work that was done along the way that included initially removal of barrels of toxic material that was found in the building. And they evaluated the site, and there was a huge number of tons of contaminated soil that was removed that contained arsenic, lead, and other things, TCE, obviously a lot of that. And that was removed. And then, and I don't quite remember the order of things, but for the board members, the best document is actually a letter that was sent from the Mass DEP to Glenn Ayers, who is on this meeting tonight, talking about what was done and the remediation and the system that was put in place, a passive ventilation system in the LUT building in order to reduce the TCE migrating upwards into the building. So meanwhile, the building had been through various stages through the planning board and the town, and it was approved to become a residential treatment center for substance abuse, which it is now. And so the question is whether that's, whether that's a legitimate use of this property now, and also whether there's any evidence of contamination in the surrounding homes. And the documents that I've gone over, it's also included in your board packet. The TCE levels are all have been measured from 2012 through 2018, and they are the TCE. Yes, go ahead, Jennifer.
The levels were measured, I just wanted to clarify, within the building proper, as well as residential properties.
Yes, I was gonna, yes,
Okay.
right. So in the building proper, the levels that were measured were above what is allowable for residential properties, but it is well within and it's actually almost within the range of residential properties. There's only a couple of readings that were above the threshold level, which is 2 micrograms per liter. Most of them were below that level. There were, I think, 1 or 2 that were above that level during the course of the numbers of years that this passive system was being monitored for its effectiveness. And so I think that the question is whether it's legitimate to have it residential treatment center. Well, turns out that a residential treatment center is not considered residence. It's a different category of building, according to the Mass DEP. It's considered in the same category as a hotel or a hospital. And so those levels that were detected here would be allowed in a hotel or a hospital. Yep, Jennifer?
A residential property, as it was explained to me, is defined as somebody who is at a property for 24 hours a day, 7 days a week for greater than 30 years, for 30 years or more. And that's what's considered a residential property by the DEP.
In addition, there were residences in the neighborhood that were tested. Jennifer, you know more about that, but those were all, there was a couple of places where there were high levels, and it was determined because the first floor levels were higher than the basement levels of TCE. It was determined that in fact that the TCE was coming from inside.
It was actually benzene.
Yeah, that was inside.
It was benzene, and the levels were detected on the first level. And they said that it was pretty much consistent with household products.
Yeah.
The levels that were detected were household product levels.
Yeah, yeah. And so the rest of them were all negative in the residents that were detected. And then having gone over that letter, all of the concerns that Glen Ayres offered, which were very well thought out, were answered in a way that I was quite satisfied with. And I feel between the Mass DEP, the US EPA, which also had some involvement in this, as well as the OTO company, who had the licensed site professional. I feel, having gone over all this, that I don't personally have any concerns about what was done, nor do I have concerns about it being approved for its current use, because that's how it's defined. And also that the levels that were found in the building were barely above what's approved for residential level, barely. And this is, again, not considered a residential center. So that's my personal feeling about it, but I wanted to hear from my fellow board members about any concerns they might have. Alyssa and Sam.
Thanks, Nancy. Nice to meet you via internet, Sam. I read your summary was excellent. I read the packet this morning and came to the same conclusion.
Yeah, I agree with that as well. I've followed a lot of the LUT property through the years, and they seem to have followed what they need to do.
Okay. So our purpose today was for me personally, to go over all of the material that I had available, to look at the data, come to a conclusion, ask questions. Is, any reason to think that something wasn't done correctly? So I've stated how I feel about it, fellow board members feel about it. And I will ask Jennifer if there was anything else that she had that was a concern.
No, I don't have any concerns. I think that I am pretty certain that there's still going to, even if when OTO submits their plans, the DEP still has to review them and audit the plans regardless. And if there's anything that needs to be done, I think the DEP will let them know. I just don't think that, because they have to put a phase, there's like different phases, phase 1, phase 2, and phase 3. So that has to get submitted and approved.
The other thing I didn't mention was the something use. Well, there's a use purpose
limitation, use limitations.
Yeah, that follows the deed of the property, and so that when it's sold, so if the town say we're concerned about, well, being sold and then it being used inappropriately, meaning for, the only use probably that wouldn't work was if it were actually residential, meaning a condominium complex or apartment complex. So that follows the deed, and so it can never be, you know, the management of the property from regard to toxicity goes forward. And also, it's important to know that you know, it's not realistic to think that it can be cleaned up 100%, that you could get rid of all the TCE. I mean, we all know we live in a world of you know, it's a chemical world, and unfortunately back then we didn't know, and so now we're left with this. But you know, we have to get it to as good as we can, but it's never going to be perfect, which is unfortunate, but it's the truth. And so we you know, we do the best we can. So I'm satisfied that the best has been done that can be. So that's I think that for me, I'm satisfied, and it sounds like my board members are as well as the health director. So thank you. Okay, next item is, let's see here.
Rental property inspections.
Well, you know, I can't quite see my entire screen here. Let me do this. Okay. All right. So I'm gonna ask Peg Hall to not. Peg, I want to go to the Styrofoam Cup waiver request, and wonder if you would be. Are you still with us, Peg? Yeah, there you are.
Yeah.
If you would be willing to, we have a representative of the Cumberland Farms Company who is here to answer questions. And Peg, if you would just present briefly about the ban, and then it went back into effect, and your thoughts about it, and see if there's any agreement we can come to with Cumberland Farms folks.
Okay, well, the agenda has me listed, and I just want to make it clear, I'm not the one that's asking for this. For people who are not familiar with what's going on, is the health department received a request from Cumberland Farms, and I believe there's a representative here from them right now, asking if they could have a temporary waiver of Greenfield's expanded polystyrene foam ban, commonly and incorrectly known as styrofoam. They said they've got some supply chain issues, but it was unclear from that letter exactly which cups they were not able to source, their cold cups or their hot cups. So before going any farther, I'd really like to know if it looks like, is it Matt from EG America is here? Can you answer what it is you're not able to get before we go any further?
Yes, I'm here. Good evening, everybody, and thank you. I think, yeah, I have a colleague, Greg, who's here, who can get into the specifics. Greg Lawrence owns our dispensed beverage business, but just to kick that off and answer that one question, two questions have come up as we've been seeking these waivers across the Commonwealth. One is it limited to coffee cups? Yes, it is. It's just our, you know, beverage cups. We're not talking about any other food service ware. And specifically, it's the hot cups that we're having an issue with. Not to answer your specific question, it's not cold cups at this time. We're just having an issue sourcing hot cups of a non-polystyrene variety. But with that, I mean, my office has been coordinating these waiver requests, and we have, you know, a handful of towns that have heard and granted these requests already, but we're still in that process, and you know, we're still kind of working through that waiver process across the Commonwealth. If you have specific questions, and I think there were some specific questions about the nature and duration of the issues we're having, and I would, if you're okay with that, I would direct those to Greg Lawrence, who can answer those in more detail.
Well, let me just get everybody up to date. So this is the cold cup that Cumberland Farms uses right now. That's a clear polypropylene. The lid is not recyclable in Greenfield, but the cup is. And then the hot cup that they currently use is also polypropylene. I know that looks like foam. It's sort of a foam polypropylene. It does have a anyway, it's also polypropylene. This is not, the lid nor the cup, not recyclable in Greenfield. So this is what they substituted when we passed the ordinance about 5 years ago, which is before my time. So the ordinance says they cannot have the expanded polystyrene foam for any product, including coffee cups. So what they're asking for, if I'm hearing this correctly, is instead of the polypropylene ones, which they're unable to get, which this sort of foam kind, I think, is mostly just Berry Industries. I don't think there's a lot of people that make this particular hot cup. So what's the other thing that's not polypropylene that's standardly substituted would be a lined paper product of some sort. So I guess that's the question: is have you looked into those, and is that part of what's also not available?
We have, and again, I'll defer to Greg on this, but we have, and we're coming here as a last resort, really. But I know Greg's on the line, so I'll let him jump on.
Yeah. So hi everybody. I'm Greg Lawrence. Very familiar with the Greenfield stores. I was the district manager for both Greenfield stores in the late 90s and early 2000s. That being said, we are here as a last resort, not a first resort. The cup that we use as an alternative to polystyrene is the expanded polypropylene cup that you see. That's what we use universally. We use that in the states of Maine, Vermont, New York, and individual stores in the Commonwealth of Massachusetts were required by law. It is a number 5 recyclable polypropylene and made as the same material. I'm sorry, go ahead.
No, this is not recyclable in our program at the Springfield North. I checked that today to confirm. The clear one is, the full one is not.
So in your municipality, you do not recycle?
In our region, it is not recyclable at our facility.
Excuse me, could everyone mute their microphones because we're getting feedback?
Getting a lot of feedback. Please mute your microphone if you're not speaking. Thank you.
Okay. So to further answer your question, thank you for clarifying that your municipality does not recycle that particular product. That being said, it does comply with the polystyrene ban, the expanded polystyrene ban, but that is neither here nor there. The issue that we are having is that early in the pandemic, and this is specifically pandemic related, early in the pandemic, there were, obviously expansion to take out products, and it put some very serious strains on the entire supply chain. Manufacturers started becoming significantly delayed. The cup that you showcased, we do roughly 25 million cups a year of that particular type in the states that I outlined: Vermont, New York, and Maine, as well as the individual cities. We have been working with the manufacturers since the pandemic began with extraordinarily extended lead times and just trying to keep the supply rolling. So this has been a long-standing problem. In the meantime, through this entire pandemic, we have been trying to find other sources for non-styrofoam cups. And the issue that we're having is manufacturer after manufacturer for paper cups, for even cornstarch-based cups, for double wall, for single wall. The issues really don't matter. The manufacturers are coming back to us and saying, listen, we have major supply chain issues. We've got capacity in our factories, but we don't have enough labor to run all shifts. We cannot take on your business. One of the largest paper cup suppliers in the country, Georgia Pacific, who is now known as Graphic Packaging. We went to them months ago when we saw the potential of this happening, and we asked them to take up, to help us to, expand the paper cup line. The answer was quite simply, talk to us in August, and we can't even have a conversation about it before then. Dart, who manufactures the plastic cup, also owns Dixie. They have a paper cup line. They said the same thing to us. Listen, we cannot take on any new business in paper at this time. Sorry, we can't help you. So we've been beating the ground trying to get any source that we can, including dealing with brokers and independent brokers, trying to find even small suppliers. We're utilizing those in every place that we possibly can right now. The issue still is, though, that the manufacturer of the cup, the Versalite cup, the polypropylene Versalite cup, has an issue getting the material that's used to form into the cup. Their plant went down around Christmas time, early January, due to labor issues, and Omicron exacerbated that issue. They saw upwards of 40% call out on shifts, and that's what caused the problem. Now, they expect to be back in production with the raw material that gets formed into the cups by early February. We expect to see the standard polypropylene cups being produced and back into our warehouses by the end of February. By the third week, we hope we are receiving 90% assurance that that is likely to be the case or to happen, as long as we don't get sent sideways in a new direction because of changes in the surge or what have you. So the exemption that we're looking for is essentially until the first week of March, when we expect to be back in production, back in supply of them. I can tell you that if it happens sooner, we'll put them back into effect sooner. But that is what we're.
So you're looking for hot cups only, a waiver through March 1st. Is that what I'm hearing correctly? We're still getting the echo repeat. Okay. Nancy, did you want to talk about the reusable cups before we go any further?
I do. No, thank you. Yes. So one of the concerns that we have, and I certainly do personally, is why not encourage people to bring their own cups in the door? Now, I recognize that not everybody's going to do that, but there are a lot of people who are willing to if they know that they can, and if they're encouraged to do so. So how can you respond to Cumberland Farms being willing to take that on, as we see trash piles, and even the cups that are compliant, they're still trash and still need to be reused. So Nicole,
I can speak to that. We discontinued our refill program only as a result of the early response to the pandemic and the pressure we were getting from boards of health across the country about the safety of refill programs. So in the contact surfaces and the safety as related to that. So if we have left it in a pause mode, knowing that may have been somewhat of an overreaction initially, as we were all washing our groceries and things that we no longer do. But if it is, the interest of this group that we bring that back up for the city of Greenfield, I'm certainly not against it.
Yeah, Jennifer.
I would strongly not recommend that at this point in time. And the only reason why is people's mouths are on their cup. And if Cumbies is not going to be able to clean things quickly, you can't take that risk. And I don't think Cumberland's could as well. I'm just saying the risk, even if it's small, I think it could be a little bit difficult. But I also have another question. We also want businesses to thrive in Greenfield. And I understand this ordinance, and on the basis of this, I agree with the ordinance, but I think that maybe they've been doing their due diligence of looking for other sources. Peg, do you know of other sources where people can look for options in cups? Because I mean, I understand being an advocate to be against it, and we're not recycling it, but do you have any idea where they can go, where they can look, just in case, because you want to implement no styrofoam?
I sent a list to Nancy of other sources, but the odds are tremendous that Greg and Cumberland Farms has already checked out most of them. I'm not going to claim that I have better knowledge about than they do about what the current supply chain is like. So I'm not against granting a waiver on that single product, the hot cups, until March 1st, because there are supply chain issues that are out of everybody's control, and we're not trying to
Well,
get our
Peg, it
businesses
would
that
be
much
the
trouble.
board, I mean, with respect, it would be the board granting a waiver. You know, I
Yes,
know you're
that's
asking
that's
us to, you know, you're coming to us, it would be the board granting a waiver,
right.
not you.
Of course.
So, okay, but you said you, so I'm just
I
clarifying
said I
that
would
right
be
now.
in favor of it. I'm not the one who gets to vote, but
Yeah,
I would be supportive of that.
Okay.
But there was, as far as the reusable cups, yes, there was the overreaction at the beginning when nobody knew what the cause was of, you know, what the transmission mechanism was for COVID, but there was a joint letter issued in, I think it was June, by the FDA and the EPA and the CDC, I think, were the three organizations nationally that said, you know, the reusable policies can all go back in place. That's it's not fomite transmission, it's aerosol, and there's no greater danger now from virus transmission than there ever has been about bacterial transmission. And if they had policies in place that previously dealt with bacterial transmission or lack thereof, then I think that should be sufficient for reinstating the reusable and encouraging it.
I do agree with you, but there's also the psychology behind COVID. And I think that we have to keep that in mind. There's some people that might be anxious. So I think that I believe in reusable cups. I use reusable cups. I agree with the principle. I'm just saying that they're trying to say about the COVID regulations. And most places I don't think are using refills at this point in time. I don't want to swear by that, but in Greenfield, I think that, Nicole, do you notice that in fast foods? Are they
Yeah.
doing reusable?
I think most of them have taken it away because they don't want to be taking somebody's travel mug that they don't know who's touched it, and then bring it back behind the counter. And I agree with Greg on the contact surfaces. I can see if you're buying a reusable cup there that is like brand new, but as an inspector, I just think in overall disease control, whether it be flu or cold or whatever, or anything, honestly, anything, putting a cup where you don't know where it's been up against the soda machine, touching somebody's lip to the soda machine, you don't know if they've cleaned it. I just think it's a big no-no.
Well, it looks like my health department is disagreeing with me on this one and Matt.
I mean, we're not disagreeing necessarily. I just think at this point in time, so far, if the board votes to do so,
Yeah, I know.
I mean, we would do whatever the board
Right.
says,
That's right.
but we're just saying, we hear a lot of feedback from people on other things, and we inspect businesses and restaurants daily. So, and we hear a lot of feedback, not just about COVID, but just about other things. And it's not necessarily people with germs, it's necessarily sometimes the businesses that don't clean things appropriately. So
Yeah.
it works both ways, you know? So, I mean, we could go into a soda machine and there could be mold inside the spigot. They don't clean it. So, I mean, we're trying to just say it works both ways.
And this is just like a little fact that I learned in ServSafe, but a soda machine and like an ice machine, those outlets, they say, are dirtier than the rim of a toilet bowl. And that's research.
Well, it doesn't help then if you have a brand new cup or you brought in your own.
No.
So
I mean,
I'm still going to be on the side of allowing reusables. I'm going to take that position. But I have another board member, Alyssa. You can vote. You may not know this, but Sam hasn't been sworn in yet, so it's you and me.
Ah, okay. I don't think we've brought anything to the table.
No, but we do need to.
Is the
Yes, that's right. We do not have a motion yet.
yeah, I'm happy to make a motion. Oh,
But this isn't for reusable cups, correct? This is
No,
for
this is-
asking if we're going to extend.
Right.
that's the question I was about to ask.
Yes. Yeah.
So
Right.
the question before us is, should we grant a waiver, correct?
Correct.
Okay. So I
March
guess the
1st.
only question I have before making a motion is, does March 1st seem like a reasonable deadline? Should we put a contingency in place? Should there be more supply chain issues?
I think they can come back to us.
Okay.
Yeah,
Well,
I think I'm sorry.
Oh, go ahead.
Yeah, go ahead, Greg.
Go ahead, Greg. And it's probably me echoing. I have horrible problems with any service outside of Zoom, so I've been trying to mute it as fast as I can as soon as I'm done talking. But it's probably me. I apologize. Yeah, I mean, March 1st is probably an aggressive timeline, but I can tell you our plans are to you know, to treat the production of the cups once it's back in production. You know, like people treated toilet paper a year ago, scooping up as much as they possibly can of it and lining our shelves with it. So we plan on really buying up as much as we can once they turn those machines on and getting it in our warehouse so that we are able to handle the ebbs and the flows. I mean, we've seen so many of them over the last couple of years. It's been crazy. It's never been worse. I've been buying cups for 16 years now, and I've seen nothing like this. But we are more than happy to come back to you guys if we think, you know, that'll be again our last resort, not our first. You know, it's going to be my goal to try to get back into business as usual sooner than March 1st. So I'm hoping that I can.
thanks. Yeah. So I mean, I'd also be amenable to sort of moving that March 1st deadline if we think that's too aggressive. I completely understand these supply chain issues. It's just been a nightmare for everyone. Nancy, I'm not sure what you.
Peg has her hand up.
It's not on the date question. It was just a side note that, as Greg pointed out, everybody knows that there are supply chain issues all over the place, but this particular one may be fairly unique to Cumberland Farms and their supplier. One of the reasons he can't switch suppliers, according to his letter, is that everybody else is trying to take care of their existing customers. So all you would be voting on would be to give Cumberland Farms a waiver on their hot cups. We're not suspending the entire ordinance.
Right.
Yes, I understand that. Thank you.
That's an important point. Yeah, March 1st might be aggressive, but they can come back and give us an update as we head into later in February and know where things are at. If you want, I mean, I'm open to March 15th. You want to give it a little more leeway? It's okay.
I mean, I don't know, Greg, what do you think is a reasonable timeline?
I would be, you know, use a phrase that my mother used. You know, I'm not going to look a gift horse in the mouth, and the likelihood of something happening is still very much there in terms of things going sideways. Because if this pandemic has taught us anything, it's to expect the unexpected. Yeah, I would be more than happy and sincerely appreciative of the extension. Again, my goal will be to do it even sooner, but to sandbag a little bit might be wise, and I do appreciate the thing.
And if I can just piggyback on that, we can certainly volunteer communication before then.
Yeah.
If there's some concern about that, we're happy to keep you apprised as the month unfolds. And to Greg's point, we're not, you know, we're really looking to get, you know, it's in everybody's interest right now to get this supply issue under control and back to normal. So if communication between now and whatever the end date is something that you'd appreciate, we can certainly coordinate that while building in maybe a little bit of a buffer to you know, give us that leeway if we need it, and if the communication, you know, in our understanding of the market evolves, you know, in the next coming weeks. It might be helpful to have a little bit of a buffer built in, but again, I think whatever you're willing to do to accommodate the request is certainly better than the situation we're in now.
Sure. Yeah, that makes sense. I just think, instead of maybe doing this at a meeting again in a couple of weeks, giving a little bit more time might save us time on the back end, because that just seems
Okay.
to be how the supply chain stuff goes lately. So I'll make a motion to grant Cumberland Farms a waiver for the polystyrene cups through March 15th of 2022.
Great. I second the motion. Further discussion? Okay. Then let's go ahead and vote. All those in favor?
Aye.
Okay, motion carries. Great. Wonderful. The question at this point is, do we offer, I think what I would like to do is just go on record that we would I would like to encourage Cumberland Farms to allow their customers to bring in their own cups. If they don't, do Cumberland Farms, you have a machine out, do you hand it to somebody behind the counter, or they do it themselves from the spigot?
They do it themselves.
Okay,
Typically, the contact surfaces are somewhat limited in that the rim of the cup seldom touches, especially in the case of coffee, anything unless a person moves it and touches the nozzle. But there are certainly applications in self-service formats that aren't ours, where you would use the edge of the cup, push against a lever, and it pour into the cup. Both applications for Cumberland Farms anyway. They should not be touching or engaging a surface with the side of the cup. So it is relatively limited for that contact service aspect. That we have been operating in, based on what the general consensus has been about, the refill mugs and the concern about it and the psychology. And we're dealing with that too, and people's fears about the contact surfaces still. So, but to answer your question, I apologize for going on. The contact should be limited. And hopefully
I appreciate that information. And I'm actually going to bring a motion to encourage Cumberland Farms to allow the use of reusable, recyclable mugs for their customers who come in for beverages.
And I can certainly commit to pending bringing that to our internal health and safety team, who has to kind of be involved in all this along with Greg's team. Presuming they have no issue with it at this point, and the knowledge that we have since the ban, are kind of walking back from self-serve reusable mugs first began. Now that we know more, now that our health and safety team has some more guidance from the public health community on what works and what doesn't, we can certainly bring that to them. And if they bless it, we can have every expectation we can bring that back and
Okay.
welcome our guests to start using those again.
Okay. Well, I'm encouraging the company, not requiring it as part of the previous. We already voted that. I'm encouraging you to do it. So that's me. Alyssa, any thoughts? Or actually, I need a second to the motion.
Sure. I'll second the motion. I guess, is this something we would vote on? Just
I want it to go down. I want it to be on the record that we made a motion to encourage Cumberland Farms.
Okay. Yeah, sure. Yeah.
Okay, so you've seconded the motion. So is there any further discussion from anybody? Okay. Then all those in favor? Okay, motion carries. All right, moving on from cups. Thank you, gentlemen, for your time. You certainly don't need to stay for the rest of our meeting. I appreciate you being here, taking an interest in our town, and we try the best we can to support our businesses. So I'm glad that we can offer the waiver.
Likewise, thank you very much. We appreciate the consideration, and we hope you have a good night.
Yes, thank you. Thank you.
Thank you. Take care, everyone.
Thank you. Thank you. All right, so I would like to go back to the previous agenda item, which is rental property inspections. And Peg, you're on again, just an introduction of what this is about and what you're asking of the board.
Okay, the board members have all been sent a copy of the goals document for rental inspections. I could do a screen share on that if you'd like me to, or you've all seen it. I can read it if you'd like me to, or we can just try to save some time and not. It's entirely up to you. This document originated with Greenfield and has since been endorsed by Housing Greenfield, which is the new group that was the spinoff of the housing forum that Greenfield has sponsored last spring, and is a very active group. They have a group that's working on housing the homeless. You know, where are you going to sleep tonight? They have a group that's working on longer term building more affordable housing. We're making there be more affordable housing. This is a separate platform. And I know everything is intertwined, but I'm trying to keep this piece a little different, slightly separate. And the concept, because not everyone on the call has heard these goals. May I go ahead and read them?
Yes. Oh, absolutely. Go ahead.
Okay. So this is a Greenfield rental housing inspection goals. There are 6 of them. It's to improve the health and safety of existing housing, especially for low-income residents, to put in place a system to proactively prevent problems rather than always responding to them in crisis mode, to remove the primary burden of proof from tenants to report substandard housing, including health and safety issues, when tenants may have concern over retaliation regardless of the illegality of retaliation. 4 is not to impose undue burdens on compliant landlords, but to level the playing field so that responsive landlords are not at a disadvantage compared to non-responsive landlords, and focus the greatest resources on problem properties and repeat worse offender landlords. 5 is to improve the efficiency and efficacy of the current system that now absorbs innumerable hours of staff time from health, building, fire, and police departments without showing improvements commensurate with said hours. And 6 is to improve data collection and record keeping to demonstrate progress, increase ability to share information across departments and across municipalities, to provide accountability, and to expose patterns and gaps. So what I'm asking this evening is if those goals are something the health department could endorse. We realize that endorsing the goals doesn't get us there, and that there may be multiple steps from multiple places to get us closer to those goals. But that goals document, if we don't know where we're going, we can't figure out how to get there. So this is sort of a test that when someone proposes something that might help, put it up against these things and say, does it meet these criteria? So my guess is that some things can be done by the health department through just existing enforcement. Some things can be done possibly through extended regulations from the health department. But it's not just you guys. Some things are definitely going to be the building department. Some things might be the fire department. They have health and safety concerns as well. Some things might end up being an ordinance, but we're not committed to going down that path. There is currently an improving improving housing to improve health grant, an IH2 grant with FRCOG, the Franklin Regional Council of Governments. And they are currently working with, let's see, I got a list from Phoebe today that I could pull up for a second. they are already talking to Irving, Montague, Shelburne, and there's some interest from Buckland about some of the IH2 principles. And there's also a longer list of towns that looking into, under that same grant, looking into moving abandoned housing back onto the rolls as affordable housing. And that would be Buckland, Gill, Charlemont, Bernardston, Heath, Leiden, Hawley, Coleraine, Irving, Montague, and possibly Conway. So there's a lot of interest in housing stuff right now. Nobody else is focusing so much on the inspections at the moment, but this is something that we think through that grant might be something. Phoebe was saying we might want to get boards of health, boards of selectmen together in the region to be talking about coordinated efforts, what could be done. But I think this is a first step to have the Board of Health endorse these as goals to say this is the sort of place we want to get, and then we still need to figure out how to get there. So that's all I'm looking for tonight. I realize you've got a long agenda, and I wasn't going to spend much time talking about ways we might get there. But Chris Forgy is already representing the City Council in looking at what kinds of things might be helpful along these lines. I'm meeting with Danny from the Mayor's office in a couple of weeks to talk about stuff that's already going on. I know that some of the coordination in that number 6 can be done through Municity, and a lot of that's already happening. They have a program that coordinates between departments. So I think there's a lot of momentum right now, and I think that adopting these goals or endorsing these goals makes a statement that the Board of Health is on board, that these are the sorts of things we want to be working towards. So that's what I'm looking for tonight.
That's a great presentation. Thank you very much. Do my board members have any questions?
Nicole has her hand up.
Oh, sorry.
I just want to touch on like 1, 2, and 3, or you know what? Even like, so my other inspector and I could get you some sort of like checklist on how we deal with the housing inspections. We already do an MRVP inspection. So usually Greenfield Housing Authority, they'll call us, say they have an open unit, and we go and inspect that unit before they rent it out to somebody else to make sure. Did you want to say something?
It's not for those types of housing. They're talking about all rental properties in Greenfield.
Yeah, no,
It's
I
not for
totally,
just MRVP.
I agree that it should be available to anybody. And then obviously, like when we have a issue that comes through or a complaint, like we try to find both sides of the story. First, we don't take sides with anyone ever, because that's been a problem in the past.
Can I interrupt really quick, Nicole?
Yep.
So we had a property today, for example, of a non-compliant landlord that we've had history with. And when the property itself was fixed for the major complaints we had, but there was trash and garbage on the porch covering the windows of this property, the landlord doesn't live on site. So when we go there, whose responsibility is that? Do we yell at the landlord, or does the tenant take some responsibility for maintaining the property and throwing away their trash appropriately? It's very nuanced. So if we have something such as this, where we have a quote unquote worst offender landlord or a quote unquote repeat offender landlord, this person would fall into that category. But I don't necessarily feel that this person should get punished for tenants leaving garbage piled up on the porch. I think that there is some tenant responsibility, and the landlord should tell the tenants, you need to remove garbage appropriately. You have enough trash receptacles to do so. But I don't feel that the landlord necessarily needs to be punished if the tenants are doing the garbage problem. Does that? There's two sides, and I feel that it's very nuanced. I'm not fully against this rental housing inspection program, but I feel if you're going to push out and say repeat and worst offender landlords, we had an example today.
Mm-hmm. And that's why in the housing code, there's tenant codes and there's landlord codes. Yep. And that's why they have that.
If I can clarify, to put it bluntly, we all know that there's tenants from hell. There are also landlords from hell. When I talk about putting on my blinders and saying housing is a huge issue, I'm well aware that there are other aspects that are not covered by this. This is focusing on landlords that are not living up to their responsibility to have safe and healthy housing. One of the things that I hear said a lot is we can't do selective enforcement. That's not quite true. What you can do is define what it means to say, we ought to be paying more attention to this one, to this person, to this property. And that's something that FERCOG says there are some other towns that are working on right now and have some ability to do that. And I'm really excited about that prospect, is to see how other people are handling it. They've already pulled for us some examples from other towns, not within our region, that have various mechanisms of going after this. And that's what I'm interested in exploring, is how do other towns do this, whether it's Chelsea, whether it's Amherst, whether it's Adams, Boston, though obviously scaled down to match us. So this is not a proposal of how do we fix this. This is a statement that says there's something that needs to be fixed. And when we go about looking at what sorts of ways might we fix it, and again, we isn't always the health department. Nobody's saying you guys aren't doing a good job. That's not what this is about. This is saying the community has a problem that's not being addressed. What are the ways we could address it? And while we're trying to look for, is this one the building department? Is this one the health department? Does this need an ordinance? Can we do something more by regulation? What support can we give you? These are goals of where we want to get. This is not a definition of how we want to get there.
Jan?
So we all know, well, maybe we don't all know, that housing is one of the key components for the social determinants of health. And everyone deserves to have good housing and safe housing and reliable housing. So the health department, of course, is one of those departments that represent the people that are in most need and want to do right by people that are paying money for a service, such as safe, affordable housing. But my question to you, and I understand once there's goals, there has to be a timeline. And I wanted to know what your prospective timeline is to start implementing these goals. And if we were going to have, when you were saying improve the efficiency and efficacy of the current system, I don't clearly know what you mean by that. Because when we get a complaint, we go out and see that complaint that day. If I get called after hours for an emergency complaint from a bad landlord, I go out at 2 in the morning or 3 in the morning to take care of that. So I just don't understand. I don't understand what you mean, or if you can clarify that. Improve the efficiency and efficacy.
Alyssa's had her hand up, but I'm going to break in just long enough to say this isn't about just the health department. This is about the entire community and all of the pieces of it. Alyssa?
Thanks. I think I'd like to ask everyone to take a step back here for a minute. And I look at this list of goals and agree with, everything on this list of goals as a philosophy. And I think maybe reframing a little bit our discussion, I think what I'm hearing is that there might be like two interpretations of this document going on. One is like the intention that we want to maybe level the playing field of how people are able to like make complaints about their housing situations, how they're able to lodge complaints against their landlords, what protections they might have, and how tenants are made aware of their rights, and that they can, for example, call the health department if they're having a problem. A lot of people probably don't know that, just in general. And then on the other side, I'm hearing a lot of like action steps for like, how do we concretely put this into place right now? And so I think this is maybe not something that's being intended to make big systematic changes in this moment. I think what what's being asked is actually to support these principles. Is that resounding to anyone? Is that
I
helpful
agree.
at
I
all?
think that's what it's saying. I'm just clarifying certain things. I mean, in principle, of course, the health department wants people to live safely and have appropriate stuff, not live in something with mold or filth, and have heat and hot water. That's why we're here, to make sure people are living safely. So I agree with this totally in principle. I just was asking, I just wanted to understand number 5, and Nicole had some questions, like I said, because it directly impacts our department, right? I mean, it affects fire and buildings and everyone else, but this would, so if we're seeing this, we are just questioning what exactly that means. And the question of classifying repeat and worst offender landlords as well as tenants. That's not listed here. It's landlords that are listed here. The tenants were not listed in the goals.
Yeah, I don't think my guess would be that, well, and maybe I shouldn't guess, but my guess would be that there probably aren't answers to those questions right now, because this seems like a really sort of in our ideal world, sort of like in the cloud, like theoretical sort of, this is our philosophy. So I don't know if there are answers to like how might it impact the department. I mean, that's the question I wrote down for this section was, you know, how will we sort of take these principles and you know, if we vote to adopt them in this way, different from other ways we've already adopted them, how would we actually manage that type of implementation, which is like a huge question, and we probably don't have enough time to completely dig into all of that tonight, but I would love to hear the rest of the questions that Nicole has.
But quickly, we have met together with Phoebe from the COG regarding this, and I have met with Phoebe several times discussing this and making it a priority. So housing is a huge priority and on my list to help. And so I just want to make that clear. So the health department, the Greenfield Health Department, has been working with the FRCOG on this initiative.
That's good to know. Thank you.
Well, I would like to make a motion that we support, maybe endorse is a better word, the goals that Greening Greenfield has via Meg Hall has put forth to the Board of Health regarding housing inspections. Second to the motion?
I'll second it.
Okay. So motion's on the table.
In terms of discussion, I'd still like to hear the rest of what Nicole has to say, because the cow left the barn pretty fast after that. If it's still, or maybe we've covered it, Nicole. It's up to you.
Do you have anything else hot on your mind, Nicole?
I mean, all I can say is all of this stuff already takes place in our department. Maybe spend a couple days in there and see how we handle this and like see what actually goes on in our department, how we handle these things, because the moment I walk into a house and I see, oh, there's no smoke detectors, or oh, there's an electrical problem, like I am on the dial getting a hold of the fire department. Oh, those stairs are rickety, I'm calling Mark Snow immediately. Like it's bum bum bum, like steps aren't missed and tenants aren't ignored when they're doing a bad job, or landlords aren't ignored when they're doing a bad job. Everybody is taken care of equally. I don't know. I just think it's already being done, but if that's what you want to put in place, like we can keep following it and even better, I guess.
Samantha, do you have anything you want to add?
I mean, I grew up with my parents owning a multifamily, so I had gone through plenty of disputes, them saying my parents weren't doing something correctly, or we had plenty of pretty horrible tenants as well, and had court cases within that. So I've been there. I understand it. I understand both sides of it. But I think in speaking to this document, it's hard when the health department's already doing those things. So I think as long as we're already doing those things, then I mean, that's where we're at, I guess.
Nancy, someone has their hand up for a long
Yes,
time.
I know. Susan, by protocol here, the guests, and you are one of the guests, and I would have to include everybody to allow them to make comments about this at this time, which I can't do. But there will be a public comment period at the end so that you can comment then. Okay?
Thank you.
Yeah. All right. So if there's no further comments from the health department or the board, I would say
Well,
yes.
I think I just still feel a little fuzzy because I read
Okay.
this document, and in principle I
Okay.
agree with everything that's in it, and I also understand that a lot of the things that are listed in this are things that the health department already does. Like,
Yeah.
that was my understanding from while I was reading it. But I do think that there are areas where taking up these goals could be good, but I just want the goals to maybe have a clear purpose. And I'd actually like to move to just table this motion and pick it back up when we could really dedicate more time to figuring out
Okay.
like how those goals might interact with things that the health department is already doing. So that way we can actually have something meaningful instead of simply taking up something without a clear direction.
Okay. So you have put a motion forth to table the current motion.
Yes.
We need a second, so I'm a second on that. And Peg, you have your hand up.
Yeah, I'm just going to clarify that this document was not written for the health department. This document is for the community, and some of it involves coordination between the different departments. So for example, if the fire department goes to a property and the police department goes to a property and the health department goes to a property twice, and then the building department goes to the property, we want to make sure that the building department doesn't think it's a first offense. So
Understood.
all of those pieces, some of those pieces are in place, and we think that there are, and the part about responding to complaints, if you look at one of the numbers there that says it shouldn't all be on the backs of the tenants. Tenants are scared. There can be all the laws you want about not having retaliation, but we also want there to be mechanisms where things get checked out that don't have to be brought by the tenant, so they can kind of stand back and make sure things are okay. I'll just give one example and then let you move on with your meeting. So Amherst, for example, has a program to register all the rental properties, and then they have self-certification. The landlord just says, every year if you're changing people, or every 3 years if you're not. I've gone through and looked at these things. And then the only time the tenant would have to be involved if they said, no, that's not right. The landlord said all of this work right, and that doesn't work. So it sort of removes some of the burden from the tenant and just has it be a policy. Well, of course you should be checking your apartments. Good landlords are doing that already.
Thank you. Jen?
I do think though, so there's two things. So I'm going to answer the first thing you just said, Peg. I think Amherst and these towns that are already implementing this, some of the housing ideas is they're charging landlords fees per apartment for them to get inspected by buildings, fire, health. So there would be a fee accompanying those inspections based on the other towns. So I think that's something that we would need to address as a as a city, if like, how would we pay for that? Because these towns are charging a fee to landlords, and not all landlords necessarily want to be part of that, right? But that's beside the point. When you were mentioning the buildings department going back and someone repeating, we have a lot of communication with each other. Just like Nicole said, I speak to the fire department daily. I speak to Mark multiple times during the day, Commissioner Snow, I should say, and we discuss properties throughout the day. We have a database where people could see each report when we go and what time. And when someone's a repeat offender, we would say, we're having a problem with this property again. What do you think? So there is dialogue, and people, first of all, when we do an initial inspection, we have to go back and follow up to make sure things were corrected. So we are going back a second time. And sometimes, especially now during COVID, contractors are there's a long line for getting things done, and we have to work with landlords, and they show us proof. I have this contractor, we're doing A, B, and C. So we may have to visit a property 3 or 4 times to make sure they're falling into compliance. So, and it would not just be health, it would be buildings, and it would be fire, depending on what topic it is. But we all work together. I think having us proactively go to every single rental property, I think, is a good idea in principle. That's what it's saying, to safety of existing housing, especially for low-income residents. So we would have to see all properties, and if people are registering for this program, and tentative fees, I think this is going to be a longer discussion. But in principle, I agree with it, but the health department already does a majority of this work. Could it be more cohesive? Maybe, but I think we already communicate extensively with each other. So I think, like you said, Alyssa, that this may be, and Samantha, Sam, I think that the board was very clear in saying that it should be up for more discussion and just more clear guidelines on where to go and what it means. So I just wanted to answer those 2 points. Thank you.
Thank you. I would like to vote on, have a vote now on the motion to table the motion. All those in favor of tabling the motion? So the motion is tabled to be taken up at a later date. And we have some work to do, some conversations to have, it sounds like, between Green and Greenfield and our department, so that we have greater clarity and what needs to happen. So Peg, I want to thank you very much for putting it forth, and we got a conversation going, which is the most important thing. This is what democracy is about, right? We're putting it out there. We're doing the messy work of talking about these issues, and we need to do a little bit more messy work behind the scenes before we can vote that forward. So thanks for coming. I would like, with permission of my health department, to move to public comment and defer the remaining things, the property inspections, air sensor grant. We actually had a little conversation about property inspections, the air sensor grant, and new patient discharge grant application. I'd like to put those up to the next meeting, and because of the lateness of the hour, ask for any public comments that we have at this point. Okay, and we have some hands going up, and Susan, I saw yours first, so I'm going to ask you, and followed by Glenn.
I'm coming on two issues. The first issue, let me speak to the housing, since this was most immediate. I think one of the things that we're looking at, both from Housing Greenfield, from Green and Greenfield, is that it does not appear that we have a system. You know, we have a lot of people working really hard, and we recognize they're working really hard. And part of the goal of having this statement of goals is to really look at this and make it a system that really works for us. And I have been a landlord, I have been a tenant. And, you know, and I've had tenants from hell as well. But the issue is that many of our tenants in town, especially in a housing market that is this tight, have the difficulty of they can't move anywhere. There's no place to move to. So when they put themselves out there to ask for an inspection or a change, they're very nervous. And what we're trying to do is figure out a way that makes it possible for the system to be supportive of people and to be normal. And it may involve a fee, it may not involve a fee. That's all those things are to be worked through. But I think one of the things we're looking at is if we can get a system in place, then it won't call for more extra work, because you'll know what you're dealing with on a regular basis, because everything will be inspected over a period of years. So that's one thing. The other thing is I am in a butter of the LUT property, and having looked at some of the same papers, I guess, that you've looked at, I have a lot of questions, and I would hope that we could have the support of the health department in trying to figure out what the answers are to those questions, because very frankly, I don't know. The water table that is under my house if you dig down 2.5 feet, you're going to find running water. We're going to find a stream. I'm hoping that water is clearing and good. And if it is, great, then I'm happy. But I don't know that for a fact. And even though my house was one of the ones that was checked by OTO back in 2013, I have not heard anything from them since that time. So I don't want to go on and on. I just want to say that it would be helpful if the health department would, I'm not asking anybody to take a stand. What I'm asking you is to be part of the process. Thank you.
Before we move forward with public comment, Nancy, would you like me to run a timer for folks? How long?
Great idea.
2 minutes. Comment?
Yeah, 2 minutes. Great idea.
2 minutes. Okay, great.
Yeah,
thanks.
Thank you.
And I can let you know if anyone's in the chat. John Bottomley raised his hand in the chat also.
Great, thanks. Glenn.
I'm Glenn Ayers. I live at 254 Davis Street, and I'm a retired public health professional. I'm a registered sanitarian, certified health officer. Then I started my career in 1980 working for the state of Pennsylvania in the hazardous waste program, cleaning up hazardous waste sites, doing site investigations, and I'm very familiar with the process that is being used at LUT, or that should have been employed at LUT. I'm sorry to hear that the board has taken the stand that you have, that you think that it is fine for people to be exposed to TCE. I don't believe that you have an understanding of the health impacts from TCE, especially to pregnant women. And I think that you need to reconsider pretty much everything that you said at this meeting tonight, because I only have 2 minutes. So, you know, you're keeping me from telling you what I really want to tell you. But the goal of this cleanup program is zero exposure. Zero exposure equals zero risk. And the goal is to clean up the site to background levels, normal background levels, to the extent feasible. That has not been done at LUT. In 2012, a phase 2 report was released that had preliminary estimates of what needed to be done, and that included putting in a groundwater collection and treatment system to reduce and eventually eliminate the TCE contamination on the site, and also the groundwater contamination that is flowing off-site and into the residential neighborhood. And the data shows that that is happening. Whether you feel that it's okay to contaminate other people, that doesn't matter. What matters is what the regulations require. And at this point, I believe that your actions are
That's 2 minutes.
seriously
Fine.
I'm going to finish. I want this to be on the record that your actions are seriously jeopardizing the town of Greenfield and opening it up to, sorry about that, serious liability to bodily integrity charges against the city for knowingly and intentionally allowing contamination to not only affect the people on the site, but also to spread into the neighborhood. This
Glenn,
is an
you're on.
active thing. So
Other
I
people
think
have
that you need to
talked
devote
also.
a lot more time to this, and you need to hear from people. And I hope that the Board of Health will fully participate going forward and represent public health, because that has not been represented in this cleanup process.
Thank you, Glenn. I
And
appreciate
thank
your
you for your
comments.
tolerance in letting me speak for more than 2 minutes. I appreciate it.
Thank you. Mr. Bottomley?
Yes, thank you for allowing public comment tonight. I have to say there were many inaccuracies in your statements concerning the LUT cleanup. I believe that will become apparent through the PIP process. I'm horrified how casually you've just dismissed legitimate concerns regarding the LUT cleanup, and that you think any exposure to TCE is not worthy of concern. Obviously, it was bad enough that OTO, our own LSP, recommended an SSDS be installed to mitigate exposure, which was never installed. In addition, I believe the AUL categorization is more complicated than you stated. Nowhere does DEP actually define a residential treatment center. There's some broad strokes there, but I think it's reasonable to say a residential treatment center where people could live day and night for 3 months is closer to a residence than, say, a factory where people come to work for a few hours. I believe the Board of Health could provide clarity about public health on those matters. And also, I want to say, I hope you will participate in the PIP process, because there are a tremendous amount of documents, hundreds and hundreds of pages. We've had experts, we've had another LSP speak at EDC meeting. It's really disturbing, and people should not be, there's questions about notification of people working in those buildings. It's just really disturbing. TCE is not something that we should be saying, oh, it's okay, it's just a little bit over the residential level. That's not acceptable. So thank you for your time and listening to me.
We also have Carissa Clifford in the chat, Nancy.
Sorry about that. I was having trouble getting my video on. Carissa Clifford, 390 Mohawk Trail in Greenfield. I'm a nurse. I am highly disappointed in that you're not advocating for the people in the neighborhoods around there that are living there and working there. I question whether it would be okay if your son or daughter or granddaughter were working there or going through rehab there. Your lack of concern feels very cold-hearted to me. It feels like, honestly, to me, I'm concerned that you're being influenced. And if that's the case, that's on your conscience. You've limited me to 2 minutes, and so I need to get my comments out to the public in other ways. And that's okay. I will print flyers, or I will do what I have to do, because I care. I care about these people, and I'm sorry that I feel like we have a health department that doesn't. I know you're good people. I know you mean well. I'm asking you to please reconsider and do right by these people. You know, this TCE is going into the Green River. When you're talking about styrofoam cups and, you know, banning plastic straws and plastic bags and being very hard on businesses that are, you know, using those things, and that's great, and that should be, but this just isn't right. And I do appreciate your allowing comment tonight. Thank you.
I don't see anyone else in the chat, Nancy. Looks like you're on mute.
Thank you very much, Alyssa, for helping to manage the public comment period. Okay, setting the next meeting, I think I'm not ready to do that. So I think we're just gonna go with adjournment. I move that
Great.
we, pardon?
I was going to make the same motion.
Okay, move that we adjourn the meeting.
I'll second that motion.
Okay, great. Thank you very much. I appreciate all of you for being here, all of you who listened, all of you who had opinions, strongly worded opinions. And I would just like to let everybody know that I've taken it all in. I've heard all those words, and I appreciate the process that we've gone through. So thank you very much and have a good night.